First, we had a massive debate on this issue, as you know. It was very frustrating for me personally. I was invited to the White House in May of 2009 to discuss health care with Rahm Emanuel. The President came into the meeting. I recommended various medical liability reforms. Rahm Emanuel said, "We're going to do that, Charlie." I said, "Great, Rahm, what are you going to do?" He told me. I said, "Rahm, that's great. I'll support you. It's not going to save you money, but I have some more ideas for you." So we had a nice conversation. The President chimed in, "Yes, we're going to do medical liability reform." When the bill was written, I presented to the American people not one word on American liability reform. Why did that happen? The President of the United States said it was going to happen, and it didn't happen. He told me and 12 other members in the White House there was going to be liability reform. Why? Because the trial lawyers didn't want it. Howard Dean said it very well. So what we need to do is control costs. That is the first order of business. The law deals with expanding coverage, but it does not deal with cost containment. That's why this law is going to fail. It will fail, and it will lead to rationing. So what we should do is medical liability reform. We should allow small businesses to put together, reach across state lines where they can receive greater discounts when they purchase insurance, get out from under the state insurance mandates. We should also make sure that individuals can buy insurance across state lines. That is something that we can do, and that will make a very meaningful difference. Because right now, we don't have that in America. One other thing that I think we also need to really focus on, making sure that the federal bureaucrat can't step between you and your doctor. We need to protect that. We need that type of Patient's Bill of Rights, Medical Rights Act. That's extremely important. So healthcare is going to be an issue that we're going to have to deal with. We're going to have to defund much of this healthcare law. The employer mandate's not going to work. The individual mandate is problematic. Many of these tax hikes have to go. The 1099 provision in the healthcare law. If you paid more than $600 to a vendor, you have to issue a 1099 form, a paperwork nightmare. So there's so many issues that we are going to have to address. We're going to be spending years.
The step that Congressman Dent would take around healthcare reform was he'd repeal the bill, which is it. He'd repeal the bill, and that would be a mistake. That would essentially be taking all the, I mean, who here wants to see the ability of the insurance companies to deny you coverage due to a pre-existing condition? Who doesn't want to have the opportunity to cover other kids up to the age of 26 on their health insurance if they don't have a job that gives them health insurance? So that's Charlie Dent's plan, is to go back to the old policies of before. We all know what has happened in the course of the last 6 years with healthcare premiums. In the time that Charlie Dent's been in Congress, healthcare premiums have gone up by 34%. We all recognize that this is a central issue to this country and our ability not just to provide healthcare for our citizens, but to be competitive in the global marketplace. Charlie Dent wants to go backwards and not forwards. He wants to repeal the bill. He doesn't want to improve on it, he wants to repeal it. There is medical liability reform in the bill. There are demonstration projects set up, and I think we should move forward with further medical liability reform going forward. But the reality is that there's not a day goes by that I don't talk to a senior citizen that's caught in the donut hole trying to make a decision between paying their rent or paying for their prescription drug health. And the list goes on, and Charlie Dent doesn't see that as a problem. He said when he got elected 6 years ago that this was issue one. It's not about rhetoric, it's about results. And he has done nothing to move this country forward when it comes to health care. And meanwhile, he's accepted $350,000 from those same medical